Kaylee, Meredith, Delina, are y'all okay with us going ahead to get started? All right, because yeah, like I said, we've got two really great speakers to fit into this hour, and this is our last Enlighten to do, so we want to move forward and get as much of this great content in for y'all as we possibly can. We'll ask you to open your chat box and your participant window. We'll do questions at the end. So either raise your hand in the participant window, or if you would like to be unmuted to ask your own question, or type it into the chat box and I'll ask the questions at the end. So we won't break for questions in between Phil and Michael. We'll wait and do all our questions there at the end. We'll ask you to stay on mute unless you are asking a question, because with 75 of us in here right now, we could get a lot of background noise going if we heard everything in everyone's office. Also, remember that we record these and send them out on Monday. I think this is going to be one that a lot of us will want to share with friends and colleagues who could benefit from hearing the same information. Before we get started with our speakers, I want to thank one last time in this every other week Enlighten setting, our amazing sponsors and partners, Mass Mutual Oklahoma. They helped us start Enlighten in person. They moved with us online, and it's not surprising when you look at history of Mass Mutual here in Oklahoma. Since before Oklahoma was even a state, they were here guiding people and helping people as they made financial decisions. So right now, in this really uncertain and challenging time, it seems more critical than ever to have a stable listening ear to help guide you on life insurance, investment, business continuation plans. If these kinds of topics are keeping you up at night, our friends at Mass Mutual Oklahoma are here to help. You can find them at oklahoma.massmutual.com, and you can find that address in the chat window. It looks like Meredith just typed it there. Thank you, Meredith. So yeah, this is our last one of our kind of every week or every other week free Enlighten Friday sessions, and thanks to everybody who's been part of these. You know, our intent with doing these, we're getting information out as quickly as we can to the business community to help people figure stuff out. And this last one is really critical for that. It's to help us as businesses are reopening while there's still a pandemic going on. We have brought you the two best possible speakers on this topic, and they're going to talk about really different parts of it. First, we'll have the COO of the Oklahoma City County Health Department, Phil Maytubby, is going to talk to us about best practices for businesses so we can do our part to help control the spread of COVID-19. Then we'll have work-life integration expert and positive psychology coach, Michael Dickerson. He's going to talk to us about how to help with employee morale, maintain company culture, and increase productivity while everybody on our team works through this really stressful work and life situation. Thank you both for being here. We're going to start with Phil, who is a great friend and partner to the Chamber. Welcome, Phil.
Hello.
Hold on.
Can I see someone talking?
How are you?
Hi, Phil.
Hey, how's everybody doing?
I'll speak for everyone and say we're hanging in there.
I tell you what, this is coming from the health department. We've never been in an operation like this before. So just to let you know, there's a lot of uncharted territory, but we're really doing well here, I think, as far as the way that we do things here in Oklahoma City. So I think we've got a lot of things to be thankful for.
Thank you for saying that.
Yeah, well, we have good leadership and we have a really, really good health department here. So, I mean, everybody has worked like crazy. No one squeaked. I mean, they're working weekends, they're working after hours. We have people that probably haven't really been off in about 100 days. So that's just the dedication level that these folks have.
So let us say then, before you start with your presentation, thank you to you and to the whole team at the City County Health Department for doing this to keep our community safe.
Oh, we appreciate that. You guys help us as much as we're trying to help you. So keep going. You ready for me to start?
I think we're ready. I think you may have a few slides. Are you going to put those up to start?
Let me see if I can make that happen.
So everybody, while Phil is getting that up, I think it's easiest to put your screen in active speaker view, but also once he's got the slides up, that will mostly take over the screen, and everybody should be able to see those.
All right. Can everybody see those?
Yeah.
All right, I'm Phil May Tubby. I'm the Chief Operating Officer here at Oklahoma City County Health Department. This is my 30th year in the health department, so I've seen quite a bit. So for me to say what I just said is that's something. So let's just get right down to it. So working in the office during a pandemic, it requires a lot of knowledge of every operational concept of your business. I know you guys have seen guidance out there from CDC, Department of Commerce. Let me just tell you, none of it was ever meant to be complete. Those are good starting points. You really have to take the time to look at your own operation. So you need to start looking at the mitigation points of ways that you can reduce risk. I mean, from the very inception of how you do business all the way through all your processes. So I was just going to start with a few things. So we have, you guys have probably already seen, like at the convenience stores, and we've even had to put in like physical barriers where people can still come in off of the street or whatever and engage with your folks and trying to protect your people as much as you can with barriers. So we use that, we use distance, and I've got some pictures of some things that I'll show you here in just a minute. One of the other bigger elements is cleaning and disinfection. You know, right now, and I'll just tell you, all these things I'm telling you are on our website, and I'll give you a screenshot of our website to go to. And
Hey, Bill, before we get much deeper to you showing the pictures and stuff, will you put your PowerPoint into the presentation view? Because I think it looks like we're looking at it just like you're looking at it.
Yeah, hold on. Find that here. Well, I'm trying to get in presentation view. Hold on.
Bill, if you clicked on slideshow, that tab at the top,
And
then hit from beginning, I think that would work. So try that.
let me try.
Yeah. There you go.
There we go.
All right, is that better? Or is it still
Wait, now go up to display settings. Sorry. Display settings and then swap presenter view and slideshow.
There we go.
100 people on this call.
There we go.
Okay.
So Kaylee and I are talking, but this looks perfect.
It looks wonderful.
Okay.
Carry
All
on.
right. So now we're in this one. So is that better now?
That is absolutely perfect.
Okay. So I know there's been questions about cleaning and disinfection, and there's different methodologies out there. I'll just tell you the best way to determine what you need to use. Go to CDC and EPA and make sure you have an approved disinfectant or cleaner. If you have a provider that provides those for you, ask them for that documentation, and they should be able to give that to you. So we'll just leave that. There's also other methodologies. I know we're looking at some 250 nanometer UV light because, you know, it's not a chemical, and you can set those UV light emitters in different places. Some of them are portable, some of them are stationary, but that's an option that I believe we're going to go to because you can basically disinfect a room in about 5 minutes. So that's just another option. I'm just trying to give you options so you can think about what you need to do for your business. A lot of it depends on, well, there's so many factors there. I'm not even going to go over it, but you have to look at what you have as far as a budget, what you have as far as personnel, what your operational procedures look like. You're just going to have to find the best thing that fits you. So one of the other items, and I'll just go directly to that, is air exchange. One of the best ways to limit exposure is to get more air exchanges through your ventilation system. So you may want to look at see how many CFMs your air conditioner is pulling to see how many air exchanges you're getting per day. We have to deal with that, particularly since we do TB. So some of you guys may not be familiar with what I'm talking about there. In most instances, it's probably not going to be an issue for you anyway. It's only going to be like we have clinical issues with people coming into our building, so we have to have high rates of exchange. So, and I know everybody receives and delivers and gets has transportation. So each one of those kind of has its own little set of items you have to deal with. Like I know when we receive, we actually spray our boxes down. And then when we have transportation, we're still trying to keep people apart. So we still don't have people riding in cars together. If you're in buses, you know, we're trying to get you apart. So we'll just go from there. And, you know, I'll answer any questions you guys want to ask me after we get finished. So for your employee considerations, right now, you're probably hearing a lot of information from us on masking because it is the one thing that's going to make a difference for us. So I know there was some information on the news this morning about somebody trying to put pressure on the governor to really support the masking effort. So hopefully that will occur. Also, hand washing and sanitizing. So, you know, the hand washing thing is 20 minutes. Hand sanitizer, you want to have a high alcohol content or another approved hand sanitizer. So make sure you look at these things and research before you just go out and buy anything. You want to make sure it's effective. I will tell you that COVID-19 is acting almost more like a cold virus now. So if you think about the things that you would put in place for viruses as far as cleaning, this is going to be really not much different. So on your monitoring your employees' health, I know at first a lot of people were doing temp checks. Some people still are doing temp checks. It's actually probably one of the most unreliable pieces that you can use to determine whether somebody's got COVID or not, because there's so many asymptomatic folks at this time. So what we're asking people to do at the health department is to self-monitor on your temperature. And then if you are ill, you know, you need to call in. And then if you're ill for a specific amount of time, then we're going to probably ask you to be tested. So there's a lot there. And when we're talking about these, I'll talk about some other items. You need to put policies in place and different things for handling people when they become ill. So on your business considerations, here's the policies I was talking about. Most of them are through your human resources. Unless you're a small business, it'll probably be the owner. We are highly encouraging people to do self-notification of a positive test to their employer. Now, when we get a case and we get notified through our acute disease database, if your business is one of the ones that is notified of a contact, you will be notified by the health department. The one thing that you will not be told is who that person is, because we can't share their personal health information. So this is where you want your staff to self-identify. On testing, you know, there's still a lot about testing. We're still the best test out there, and the one that we use for confirmation is the PCR test. That's the one with the nasal swab. There are also other test methodologies that are out there. There's some antibody testing. It's probably just a little more than half, you know, 50% reliable. But we do see some use for it later on, doing some saturation studies with our population. Also, you may see some antibody or some antigen testing develop here in the near future, and hopefully that will be something that we can use. I wanted to talk about using reliable sources of information. If you're using the internet, you may be getting a lot of misinformation, because there's a lot of, we've done some research on messages that are out there, and some of the messages are controlled about 70% by bots. So somebody's actually out there trying to control the message. Make sure that if you're going to use information, get it from a reliable source like CDC or National Institutes of Health or HHS or your health department, because those, we only use peer-reviewed, absolute things that we know for sure. So just be hesitant if you're seeing something other than that, because sometimes it's just somebody trying to give you information you probably really don't want or need. So as far as your positive employees procedures, like I said, you will be notified if you have a positive employee from the health department. At that point, you would want to have procedures in place to deal with that, which would be enhanced cleaning, seeing if you have distance and space between people, making sure your PPE is in place for all of your employees. This is the #1 thing that you're going to see moving forward. And if you have PPE on, even if you get exposed, the chances are that your exposure will be minimal and we may not have to do anything. If you aren't wearing your PPE, specifically your mask, then you may be asked to go in and either quarantine or be tested. So keep that in mind. One of the other issues that we've got going on right now is the mental health piece. And I know my other speaker is going to talk about this. So I won't go into that. So this is some examples of the information on our website. I'm sure you saw something about our Series 7. These are things that we are finding now through our contact tracing. So these are issues that we are getting, and I'll just tell you, there's good and bad examples for all of them. So we're not trying to generalize, but just as a rule, these are where we're getting contacts. So when we talk about house, that's just families getting together. Some people are good with their PPE, some are not. Funerals, bars, church, I mean, it's all over the board. Some people do really well with it and others don't. So, this is our message. We've got to get out there about the distancing and the masking. And, but if you will go to our website, we've tried to collect all the good, valid information that we can find from any valid source that you can utilize. So all those things are on there. This is an example of a barrier that we put up. That glass did not used to be there. So that's just one of the issues we had to put there. This is another example of just putting up a barrier to put distance between outside folks and your folks. So that actually is working. This is an example of a meeting room setup, 6 feet apart. So, for some of your meeting spaces, you need a lot more space. And we realize that some points, they're going to be mixed meetings, like where people are actually sitting in a room, but you may have Zoom participants on another one. So that's really all I have. So I just wanted to try to get as much information out there as I could. Our cases are starting to spike up a little bit again. I know yesterday we had 93 cases. I haven't even had time to look at what we've had this morning. But so far, our death rates are staying down there and our hospitalizations are rising a little bit, but they're still in a manageable range. So we're good. So if I could get one message out to everyone today, it would be about masking, wearing personal protective equipment, keeping distance between people when you can. It's because our economy is going to depend on it. Let's take it's not a political issue at all. This is about, do we want our economy to survive? I know people want to go out and eat. They want to go do what they want to do. And we do too. Believe me, we're not anti-economy. We know we're dependent on the economy as well. So the best thing that we can all do is to try to make sure that we have people masked and distance. So one of the things you'll need to think about also is when people come into your business, are you going to require them to be masked? Also, I know a lot of businesses are keeping contact lists of people who come in and out of their building just in case we have to do contact tracing. I'm just giving you ideas. These are things that I really want you to sit down and think when you have time about all your processes from start to finish with your business, and just kind of think about the ways that you can mitigate or lessen the possibility of exposure. That is really what this planning is about. So you need to have a plan in place for your business, and it needs to be scalable. So I hope that's good enough, and I'll try to answer some more questions for you later. So
Bill, that is an amazing start, and we already have a boatload of questions for you that have come in, and one that's come in for Michael before he's even started talking. So I think if we can jump to Michael now, that should give us time to get in a lot of these questions here at the end.
Okay.
So thank you so much, Phil, for those remarks. And Michael, we welcome you for your presentation. So I guess we will share your screen and start to see your slides up here next. Yeah, everybody who's here, we've gotten so many questions to come in. I think that with the time that Phil finished, if we get Michael going here next, we may have like even 20 minutes at the end to talk through some of the stuff, which I think we'll really need, looking at everything we want to talk some more about already.
So
All right, that looks great, Michael.
You see
Wonderful.
my screen? Everybody see the screen? All
It
right.
looks great.
All right, so thank you for having me. I was excited when they asked me to speak on this issue of just working from home. This is a big issue right now. A lot of people are dealing with this, a lot of businesses and organizations. So what I'm gonna really do is just highlight some things, because I was just telling them earlier, like I could probably take up the whole time talking about this issue. So I'm just gonna try to give you some nuggets to talk about just some strategies to maintain employee morale, company culture, and productivity from working from home. Now, my background is in mental health, and I'm also a positive psychology certified practitioner. And so the lens that I look through when I work with businesses and organizations is what I call positive organizations. And so what does that mean? Positive organizations, it's just about the people flourishing at work. And really, when you talk about outcomes, are your employees, are your colleagues, are they exceeding whatever expectations that you have set in place? And so that's what I look at when I look for positive organizations. When I talk about positive psychology, all I'm really talking about is just looking at what is right with organizations, what's right about people. They have a big research and a lot of evidence-based things. That's why I like positive psychology. But ultimately, for me, it's just about, are your people flourishing and are they exceeding expectations? And that's what we want with really positive organizations. So let's just look at beneath the surface of some of the work from home challenges. And I'm sure y'all are seeing this right now. We know a lot of people are going to these things. So like burnout. What I deal a lot with is, she talked about work-life integration. Like that's a strategy for me. That's what I use as a strategy to work with organizations. Of course, positive organizations is my ultimate goal, but my strategy is to deal with work-life conflict. And so that's why I call it work-life integration. Of course, with mental health in terms of depression, we are seeing rates of depression increasing out the roof. And so that work from home piece this is a really important piece to help try to just give you some strategies to deal with that. Then you see isolation, of course, stress, loneliness, and then you see, of course, there's a lot of worry, there's a lot of anxiety that's going on right now with the COVID and with all the social issues that we're dealing with too. And so we're just really looking underneath and what are some of the work from home challenges. And so let's look at company culture. Let's look at what that means in terms of where you at. I want to deal with company culture first because really that is what drives everything in terms of what goes on in your organization. So let's look at company culture. I like to define culture as just deeply held assumptions and belief that drives behavior. So that's just the most basic and fundamental way that I can really describe culture. And so there's a couple of things. So when you talk about culture, culture is so broad. I mean, there's so many things that we could talk about with culture, but I'm gonna give you 3 things here that I think that is really pertinent right now that you really need to be dealing with, especially with your employees and your colleagues from work from home. And when you look at culture, the cornerstone of any type of culture is what I call positive relationships. Relationships are everything. And so we know people tend to stay at businesses and at organizations because they have developed really good relationships with their coworkers. And then we also know a flip side that people leave because of bad managers or bad leadership, because of not really great relationships. So I always try to say, well, how's your relationships? Are they positive and are they healthy in your culture? And so I don't know if anybody ever heard of the relationship expert Esther Pearl. She said the quality of your relationships determine the quality of your life. And so I like to implement that into a culture. Like that is so important. We know that relationships drive everything. And so I would say the cornerstone of any really positive culture and healthy culture is going to be relationships. Number 2, the thing that you should be doing right now is having authentic conversations with your employees and colleagues within your organizations. And I'll give you some strategies here in a second to how you go about having authentic relationships. And then one of the things that I think is important is that in your organization, in your business, you need to be talking about what's the new possibilities and opportunities. What I think is happening right now because of COVID, everybody is going on the defense when you should be going on the offense. When you should be thinking about what opportunities and what possibilities are amongst us. And so I think we're not hearing that enough within our organizations. All we're hearing about is how to play defense, how not to lose money. We got to cut employees, things like that. And I think we need to also be looking at what's right and what's positive and what those new possibilities and opportunities might be for our organization. So I'm just going to, after each topic that I'll go over, I'm going to give you some strategic actions that I think are really important. I think right now strategy is everything. I think you have to have a strategy. So I'll give you some short-term strategies, and I'm just going to give you some long-term strategies. I'm not going to go too in depth on all of them just because of time's sake, but let's look at some short-term strategies in terms of your company culture. So I think frequent two-way communication is really important. I actually think right now you should be over-communicating just because when a person is working from home, they want to know what is going on. I should be receiving emails like updates on things. One of the biggest things that I hear is like, I don't know what's going on. Our leadership is not communicating with us. We get an email every 2 weeks. Like, I think you should be over communicating. I think that's really important, and it needs to be two-way. We talk about having authentic conversations, like let's have a two-way conversation with our employees. Let's have a conversation with our leadership. Leadership should be talking really to their employees, really saying, hey, this is what's going on. Managers should be constantly talking to them. So these communication things are really, really critical. Implement some team virtual activities in terms of your culture when people are working from home. Like it shouldn't always just be about when we meet, we just having meetings. It should be about some virtual activities that we do just to make it where we feel like some camaraderie and we still have really positive relationships. So I think that's important. And then you also, in terms of new opportunities, you want to embrace input from your employees, because a lot of times your employees, they see opportunities that sometimes leadership don't see and sometimes even managers don't see. And so that's why that two-way conversation is really important. So you need to be getting input in terms of what new opportunities or possibilities like you might see. And then for long-term, just communicate what new opportunities you're going to focus on within the next 1 to 2 years, 3 years. I think that's important because that gives people hope. And what we really need right now, we need some hope. And so I think that's important for those individuals that are home. And then constantly promote a culture of inclusion and belonging. You want to make people feel, we talk a lot about diversity and inclusion, but belonging is really important too. People need to feel like they belong when they're working from home. So if you can do those, just those few little actions that I gave you, I think it'll help in terms of with your culture right now. Culture is such a big deal. I can go on and on about culture, but I think if you use a couple of these things, or you just take one and try to implement, I think it will help your culture. So let's look at employee morale. So when we're thinking about employee morale, what we're thinking about is enthusiasm, just the enthusiasm of do the person like their job, how they feel about the organization. So employee morale, that's what we're thinking about. And so one of the ways that you can boost employee morale, and every organization does this, but I think you have to even do it more so now because people are working from home, is just recognize their hard work and their accomplishments. So, and also like birthdays, you still want to do that. So I know we do that with emails and things like that, but we want to definitely continue to recognize that. Work anniversaries, if people have work anniversaries, if somebody has a baby, like we want to acknowledge those things, just give them recognition. If they accomplish something in terms of when they was working from home and there's a big project going on, like please recognize that hard work of their accomplishment. Use empathy to address any type of needs or concerns your employee have. So that'll boost morale. Also, ultimately, you really want to help individuals in terms of morale, looking at purpose and meaning. Right now, we want to understand what our purpose is and what meaning is, and this is a huge piece in terms of just helping managers, employees trying to find purpose and meaning. So let's just look at some strategic things that you can do. So for short term, try to plan some fun virtual activities. So that goes with sort of what I was talking about with culture earlier. Show patience around any needs your employees have. Then once again, you're going to provide regular employee recognition. Like we want to make sure that they understand we're recognizing them for their hard work and the things that they're contributing to the organizations. For long term, once again, help employees discover meaning and purpose in their work. And it sounds very pie in the skies type of things, but here's what I know, and I talk to a lot of millennials and Gen X and Gen Zs. They want to know that they have purpose in their work. They want to know that they have purpose within their organization. And it's really hard to retain, and it's really hard to get people on board if they don't feel like they have a purpose or a meaning within the organization. So that's really, really critical. Also, focus for long term, focus on identifying and utilizing employee strengths. I am amazed at how many people do not know their strengths. We have them in certain roles, but they don't know what their strengths are. So if I go, what are your strengths? Nobody can really tell me what their strengths are. And I think it's important that you identify strengths because we know when individuals have really thrive in their strengths, then that helps them in terms of their morale. They feel enthusiastic about doing their job. So really, if you can, one of the things that you can really help employees is like help them discover what their strengths are. And I think that's a very long-term thing that you can help in terms of an action. Let's look at the last little thing in terms of productivity. So productivity and work-life integration is the #1 issue on employees' minds. And so I read a lot about work-life integration and what productivity looks like in terms of the research. I look a lot into what HR managers and executives are seeing right now when COVID hit. And one of the big things that they hit in terms of was productivity and work-life integration. So what does that mean? And we're actually talking about that is really understanding this work from home piece. That's what it's saying in terms of that's the #1 issue right now. Now, the first thing that if you really want to help your employees be productive, working from home, you got to get them the technologies and the tool to work efficiently. I think that's, so I know everybody's really new to Zoom, trying to learn Zoom, but having the proper tools to be able to work from home is really critical. Even if you're at an organization and if you can offset some of the cost, maybe somebody might need a hardware, or maybe they need a better camera, or maybe they might need a better mouse. Like if you can offset some of that to help them just to work better, it'll be really great in terms of their productivity. And then also looking at what technology softwares that you might need to think about in your organizations. And so Slack is a really big one. So I do a lot of stuff on Slack. I have a friend who works with an organization. They do Microsoft Teams. So I know a lot about Slack. I don't know much about Microsoft Teams, but those are the 2 most popular. And then what's coming coming a close second, and it's coming right behind Slack and Microsoft Teams. And I don't know if y'all heard of this, but it's called Facebook Workplace. And it's also a technology tool that individuals are using in terms of making productivity more efficient for those who are working from home. And if you've never used any of these, you can do email, you can do video conferencing, you can do calls on these tools. Like these tools, man, technology is disrupting everything. They made it so great where you can communicate with your coworker and colleague instantly on an everyday basis. And so I think if you really want them to be productive, like your organization and your business really need to be thinking about what tools are we using to make it more efficient. The second thing is, and for me, this is really important, is about so we know right now we're dealing with this COVID thing, and Phil just talked about COVID and what that means. If anything that we've learned through this COVID is how important our health and how important our well-being is. And you really need to be thinking about well-being. And I like to call well-being positive. I call well-being positive mental health. And because a lot of times when we think of mental health, all we think about is the illness side, or what we call the deficit side of mental health. So that's dealing with depression, or you're dealing with anxiety, or somebody who has OCD, or an individual who has a psychosis, or some type of schizophrenia they're dealing with, or some type of personality disorder. So we think about all the deficits in terms of the mental health issues. But what we're starting to find out now, that mental health is bigger than that. It's really about what I call positive mental health. It's about well-being. It's helping that individual cope with stress. Are you helping them realize their full potential? Because if you're not healthy and you don't have good well-being, good positive mental health, you're not going to be a productive worker. And so this is really important. So well-being is like critical right now. And when you have good well-being, people work productively, they're more fruitful in their work, and you see them really overcome challenges that they might have because of good well-being. So we want to put those things in place. So remember what I talked about earlier, positive organizations. Are they exceeding expectations? That's what we want with productivity. And then the last thing, a lot of what I talk about and the strategy I use is called work-life integration. I'm on a mission to change the language from work-life balance to work-life integration. Because every time I used to ask people, I was like, well, how that work-life balance is working for you, and nobody could tell me. So I figured there's no such thing as balance. So when I looked at the research, I started seeing work-life integration meant that people are more integrated in terms of their work and their home. And we're seeing this, like we have accelerated. We have seen how work and home go together. I'm trying to work. I'm trying to have a healthy relationship with my spouse or my partner. I'm trying to take care of kids. I'm trying to do all these things. So there's no balance. It's just all came together. So I say work-life integration, not work-life balance, because balance is this old outdated idea. You're going to start hearing more with work-life integration. So when I talk about work-life integration, I believe that work-life integration is just going to move into flexibility. So when you're talking about work from home, what you're talking about now is flexibility, and flexibility is just not working from home. There's all different types of flexibility strategies. I won't get into those just for the time's sake, but there's all different. So you just don't have work from home. You might have some part-time workers, some contract workers. You might have what they call a compressed work schedule. So there's different types of flexibility. And then ultimately what work-life integration is, it's just dealing with the whole person. And then dealing with that conflict of dealing with kids, trying to have a healthy relationship with my spouse or my partner, trying to be productive at work, And then also trying to have a life outside of work in terms of taking care of my well-being, and then also, you know, trying to live out my full potential. And that's a lot. So it's really about dealing with the whole person. So let's just look at, before I finish up, this is the last slide, is just some strategic actions. So for short term, I think it's important, don't always just Zoom or text. Call one of your colleagues. I think we've got away from just calling. Like, it's easy to just text, it's easy to just Zoom, but there's nothing like if you just call an employee and it's like, hey, how you doing? How's everything going? Especially when somebody's working from home, got 2 or 3 kids at home, you know, trying to work, trying to be productive. Like, a call, I mean, I think it goes a long way. So I think that's important. So when you talk about work-life integration, the flexibility talks about allowing employees to decide when, where, how, and with whom to get work done. This is not a time to have micromanagers. This is a time to give a lot of your employees, especially when they're working from home, the autonomy to be able to do their work when they want to do it, where they want to do it, and how they want to do it, and with whom they want to get work done. And the best way you can do that, you need to put things in place to be able to measure that. Some people work really well between 8 and 10 p.m. at night. Some people work really well between 7 to noon in the morning. So I think it's really important that we understand in terms of flexibility, like, these type of things are critical. We cannot be micromanaging people at home. There's too much going on. And so that's the thing about flexibility. And then social support is really important. This means having daily and weekly check-in with your employees. So I just did a mental health webinar with SageNet in Tulsa, Oklahoma. And they do some check-ins. They do a check-in on Monday, and then they did a check-in on some Fridays. I know another organization, they do check-ins every day. And so I think daily and weekly check-ins when working from home, I think with your employees, that'll help a lot. So social support is really good. And then just the last piece of this is, if you can, work from home, offering some workplace coaching, and then putting some well-being training programs in place. Right now we have Zoom, we have a lot of virtual webinars going on. So the technology is there to do that. The technology is there to do some coaching. The technology is there to provide some well-being programs to really help people in terms of really dealing with that positive mental health, making sure they're being healthy in terms of their whole being. And then the last piece I think that's really important is you need to partner with some type of mental health professionals, just because of the increase of mental health issues on the deficit side that we're starting to see in terms of depression and anxiety. The number one thing that we're seeing increase is some depression. And just because of my background in mental health, I think I am pushing now that organizations should have some type of, I know organizations have EAP programs, but the usage is very low. I think more organizations, and we need to try to protect it because of HIPAA laws, but we need to have some type of mental health professional, like, have access to them right now. We don't need to be able to schedule something. We need to have access right now. We need somebody to be able to call if they're in a crisis. And so if you can partner with any mental health providers or any contract counselor, like, I think that will help with any type of work from home issues that some of your employees might be dealing with. So I am gonna, I already emailed the slide over. You can have this slide if you have any questions, or if I didn't answer anything, you can always contact me. I'm always on LinkedIn. That's where I play in terms of my social media on LinkedIn. I love LinkedIn, and just connect with me, and I can do anything I can to help.
Michael, thank you so much. You have spurred a ton of conversation here in the chat box. And so I'm going to jump right in with questions. We've gotten loads of questions. And I also want to say, I think we'll do our best to get questions out to the speakers to try and get you follow-up answers if we don't get to them now in the next 15 minutes. But I'm going to start with a question that didn't specify who it was for, but I think it could be for Michael or Phil. So y'all may both have something to contribute to this. And this was an anonymous question that came in directly to me. In terms of morale and culture with people working in the office, how do you handle it when everyone has a different idea of how to respond? An example would be people who want to wear a mask versus people who don't want to wear a mask. How do you handle that from a culture standpoint?
I think that's a policy issue. I think there's not a set policy in place. I think you need to put a set policy in place, and you got to hold everybody accountable in terms of making sure that they abide by policies. We have different policies for everything else. We have to abide by those. We need to have a policy about a mask. And so I think that's important. So I think Phil may be able to speak.
I see Phil nodding. Phil is nodding along as you're saying that. Phil, any input on that?
Yes, we actually do have policies internal. So that's one of the things that I was going to try to get to with all of you. You all own your own businesses. So you're the one that dictates the policy within your organization. So we know that the masking and everything else really has helped. You know, we've had really no issues here with 200, almost 300 people now. So it works. So we have made it mandatory to protect our response. But you should probably look at your policy, because it's also going to keep you in business. If you get all your people exposed, guess what? You're not open, because you're just down. So people really need to think about that.
Excellent. Thank you both for that answer. This next question is for Michael. Michael, do you have any tips for making Zoom more effective as a way to maintain culture and communicate?
So with Zoom, I think if you're doing any type of activity or anything, I think you need to do breakout sessions. So we have a lot of people here on the Zoom, and if I was doing some type of program right now, I would probably break y'all out into sessions and give y'all an activity to do. So that's the best thing about Zoom is like, I think there's a lot of things you can do. And so I think people still learning, but when I do trainings, and if it's a long training, if it's 2 or 3 hours, I'm breaking you out into, cause that builds camaraderie, that builds relationships, and it makes it more smaller. So I think breaking them out to sessions is really good. So that's the best tip. That's the best tip that I can give on that.
Excellent. We have seen that in our programs too. The breakouts are legit. One of the first questions that we got for Phil is a real practical question. Phil, Tara would like to know, how does an employer get set up to receive the positive testing notifications?
You don't have to worry about getting set up, because you're just going to be notified. So that's something that we pick up. So we get our test results. Whenever you do a test, you have to submit a lab form with the contact information on it. So once we get a positive test, we do contact tracing. And those are the things that are identified. Well, that's some of the questions that we ask, like, where do you work? And then we ask for contact numbers, and you will just be contacted. So you don't have to sign up for it. It's automatic.
So we should know that you're coming our way if there's something we need to know.
If you get a positive, you will be contacted by the health department.
Excellent. Thank you so much, Phil. Next question for Michael. What tips do you have for building trust in order to have uncomfortable conversations around diversity, inclusion, and belonging?
Ooh, yeah, so diversity and inclusion is not my expertise. I think it goes back to the two-way communication. I think you need to bring leaders in. You need to bring your executive people. You need to bring leaders in, and you need to have real conversations. Right now, I think the most important thing you should be doing is listening.
Good advice.
Yeah, listening is critical right now. Don't try to solve the problem. Don't even try to have a conversation. Like, just listening to what your people are telling you. I think that's so important right now. Listening is the key.
That's good advice for us all. Thank you, Michael. Here's another question for Phil. And Phil, y'all may have started talking about this in the chat box. This was a question from Jamie. If employees are 6 feet apart in a meeting, are masks still advised?
Yes, they are. The 6 feet is the minimum distance. So we're still recommending that masks be worn. Actually, masks should be worn, you know, as long as you're around other people. So, because you never know what somebody's going to do. Somebody's going to walk up or, you know, especially if you're walking down a hall. So yes.
Excellent, thank you, that is helpful. Okay, here's another question that came in for Michael. Michael, this is from some folks, there's I guess a few folks from One Workplace Together on the call who said it really resonated with them when you talked about now not being the time to micromanage and manage people's schedules, just to let folks do things how they need to do things. Do you have any advice for people who might need to talk to their leadership if they feel like that's happening in their organization, how to approach that conversation if it's a level above you?
Yeah, the conversation is just, I think you need to go straight to them and tell them like, hey, here's the deal. And I think you need to explain what your situation is. Because if I have 2 kids at home, just imagine this. I have 2 kids at home. I've been accelerated into working from home. Maybe I'm uncomfortable still working from home. And I got to try to teach my kids in terms of school. Like I think you need to give them context. Give them context and say, here's the situation. A lot of times people just don't know what the context is. And then I think you back out. But I think being real and going to like, hey, man, my kids are at home. I'm trying to make sure that they get their schoolwork done and I'm trying to work. And I think that's the best way to go about it. But I think you have to be honest and real and tell them what your situation is.
Thank you. That's back to the communication. That's key. I've got a couple for Phil. One is real short and one is a little bit longer. Phil, will you repeat the information about the 5-minute disinfectant? And then I've got a longer one.
Sure. That was the UV light. So you need to get the right kind. It's a 250 nanometer. That's the wavelength that you need to make sure that you kill the COVID virus. Some hesitancy with that though. You need to know what you're doing. So 1 minute of exposure to that without eye protection can damage your eyes. So that really needs to be handled correctly. I mean, we have safety officers and they're the ones that will be going around and doing that. So just think about it. I mean, everything you have has a good and a bad point. Yes, it works quickly. Yes, you need to be careful how you manage it.
Okay, then here's a little bit longer question. If a business requires masks, is there a common stance on the medical exception?
Yes, it's been anyone with breathing difficulties. So, you know, that's going to be self-explanatory. If somebody has shortness of breath on a regular basis, yes, they can probably be exempted from that. Just realize when you exempt them though, that you're actually kind of putting them at risk. So they need to realize that when you give them the exemption.
Okay, thank you. That's really helpful. Another question for Michael. I think we can maybe do one more question for each and then we need to wrap up. For Michael, are there any online therapy apps that you would recommend talking about that more urgent care on counseling for people? Are there any of the online platforms that you
yeah, those are exploding. I can't name any right off, but I will, whoever that is, tell them I will email them some apps and get them to them. So if they give me their name, give me their email, because that's a great question. That's actually exploded right now. People are using that like crazy. I just don't know. And so I want to make sure that what's the most evidence-based apps that people are using in terms of therapy and what's the best one, so I can get them some information and email them some great apps.
Excellent, very helpful. All right, last question for Phil. How should employee travel be handled? What if employees are attending one of the Series 7 as an employer? How do I handle that?
Okay, that's a 2-part question. So as far as travel, we're still recommending, I mean, air travel is still, you know, what it is. So if it's air travel, it needs to be really necessary. Now, when you're talking about working with the Series 7, If you know you have somebody that's not compliant, I wish I had a better answer for you. I don't know. I mean, yeah, I guess you should talk to that employee. Just say, you know, you're putting yourself at risk, and now you may be putting my business at risk by going out and going to these, you know, these types of activities. So I wish I had a clear answer. I don't. I'll just tell you, there's a lot of people out there that are not mature and they don't know what they're doing. So I know every employee deals with that. So that's probably going to be more of an HR or a policy issue. I mean, as far as if you give directions to your staff and they don't follow you, for us, that's a failure to take direction. So I'll just leave it at that.
Thank you. Complicated situation. Both of y'all have helped us think through a lot. We do still have a lot of questions. So events team, can I ask what we might do with the questions that we've got left here? We're going to send out the slides that we had.
Could distribute these questions to both speakers, and maybe if you guys are willing to provide some bullet points, written answers, we could send that out on Monday with the recording.
Excellent, because yeah, I think that a lot of us have seen these questions in the chat and might like to get the answers, even if it wasn't our own original question. Michael and Phil, thank you so much. I think we wish we had all afternoon just to talk this stuff through with y'all. I know you're both so busy right now, so we're very grateful to get this time over lunchtime here today.
Thank you.
Thank you. Thank you to everybody who attended today and everybody who's attended our other Friday Enlighten sessions. As we said in the beginning, this is our last one that we're doing on kind of this schedule, and that's because we've got other chamber events that are coming back. They're coming back online, but we've got some important ones coming up in the next few weeks. One is we've got the July Chamber Forum coming up. We're going to talk about the projects that are currently shaping the downtown skyline here in Oklahoma City. Michael referenced the breakout sessions in Zoom. We did that in the forum in June, and it was phenomenal. It felt like real networking, like being back in a room with folks. So if that's a thing that you're hungry for in your organization right now, come to forum, because you'll get to spend some one-on-one time with other great business leaders. It's going to happen on Wednesday, July 15th. It's $15 for chamber members and $25 for non-members. This is very important right now. You won't want to miss the State of Health event. Is coming up on Monday, July the 13th. There are going to be some phenomenal panels, one on public health, one from all the leaders of our four major health systems here in Oklahoma City. So you don't see that anywhere else besides State of Health. And then we've also got a nationally known healthcare and finance filmmaker, Ron Galloway, who's going to give a keynote on how innovation and technology could lead the way forward in the post-pandemic world. Tickets are $25 for chamber members and $40 for non-members. You can register for all these events at okcchamber.com/events. Thank you, events team, for making all of this possible. As y'all might imagine, it's taken a lot of pivoting and figuring out how to do all this stuff differently, and I think we're really proud of how we've provided information to everybody. As we conclude, we want to thank MassMutual one last time. They've been great partners to us and seeing us through a challenging time. Thanks again to Michael and Phil, and thanks to you all for being here. We're adjourned.
Thanks. Bye, Sonny.
Bye. Thank you. Thank you.
Yeah, just get us the questions. We'll answer them as we can.
There's loads. There were loads of them, and I think some of them we might be able to kind of lump together a little bit. But golly, people wanted to talk.
Well, you know, this is something I realize it's something we need to do. I mean, there's so much information out there and it's so generic. People are really trying to get answers, and you know, it's real easy to get off track, especially if you're on the web looking for information.
Well, and I think it helps people to hear from an expert like you that like some of this there's not an answer to yet. And it's not that you don't know what you're doing. None of us know what we're doing. And hearing that from an authority, I think probably eases some minds a little that they're not in the dark.
Yeah, I mean, we're not going to tell you something that we don't know. I mean, we just don't do that. We're going to give you facts. So we have to. If people quit believing us, we're in trouble.
Well, that's why you're a trusted source. I also really appreciated that I could see your clock over your shoulder the whole time, so I knew we were on time when we were.
Yeah, I kept you on time. Actually, we hit it perfectly, I think. So.
We were dead on, and we could have stayed on questions, seriously, another 30 minutes, but.
Oh, yeah, I could actually talk about this stuff all day. It's just, I don't really have all day, so.
You don't, I know you don't. So knowing that, we'll let you go, but thank you, and it was really good to see you.
Yeah, good to see you too.